In the book, it does allow you to do this in one of two positions. It's a rolling stool I can borrow. You can do the Dorsi Flexion with your patient sitting, and you can prop their foot up onto yours and do your measurement here. I prefer to have them lay down if I can. So you're going to lay on your back. And if you want to open your book, probably should be looking at your picture. So we are on a little bit of a smaller area now. So I'm actually going to switch to using the smaller goniometer. You guys have a smaller one, correct? So when you get to the ankle and the wrist, and sometimes even the elbow, depending on the patient, usually go to your smaller goniometer because it's harder to kind of line this up. See how much bigger it is than the actual foot itself. Okay, so somebody tell me what my fulcrum is going to be. Lateral malleolus. Okay, is there more specific than that? Slightly inferior to the lateral malleolus. So you're going to find your lateral malleolus and go maybe just like one finger width right below that, kind of just underneath it, okay? Just inferior. And then your stationary arm is going to really be the middle of the leg. And what you're going to use as your landmark is the fibular head. Okay? So there's three major bony prominences on the lateral knee. One is the condyle of the femur. One is the tibial plateau, because it's kind of a bony prominence. And then the fibular head is actually back, more posterior than the tibial plateau. So people, when you're looking, when you're trying to find the fibular head, you need to come up along the lateral leg, but make sure that you're not here, because there's a bony prominence there. It should be posterior to that. So find it on yourself right now. You can follow the fibula up. There are the peroneal muscles that are going to be on top of that. But if you follow it up, it's going to be more posterior. Okay, are you feeling that? And it's a rounded prominence, fibular head. Okay, I'm looking around. It looks like you guys are on it. Okay. That'll be something we'll be checking as we're walking around. Okay, so now just inferior to the lateral malleolus, fibular head, and then my movable arm is going to be, and this has changed over the years. These days they're using parallel to the plantar surface of the foot. Okay, and since the foot changes, you guys see that? Like there's a line kind of deviating a little more down, and this one's a little more flat. Use the heel. Okay, so there's kind of a dotted line here that keeps going straight, right? Because the calcaneus is going to be the movable bone, right? All right, so let's use the calcaneus. So we're lining it up with the base of the heel, and that's a parallel line. So I can't line it up with the base of the heel, can I? Down here, it's a line along the base that continues on, and you're going to make this parallel to that. All right? And then we need to make sure she can get to 0, right? So right now, would you say she's in a little bit of plantar flexion? Mm-hmm. Okay, I would agree with you. So we know she can get to 0 because she's in plantar flexion. She's past 0. So right now, if I look at the goniometer, it says 20 degrees. But she actually has to dorsiflex to get to 0, okay? And then she'll go beyond 0. And so right now, the goniometer is reading about 10 degrees, 8 degrees, okay? So even though she was at rest at 20 degrees of plantar flexion, she got to 0 and then went another 8 degrees, her dorsiflexion is 0 to 8 degrees. Does that make sense? Forget about that 20. Now, if she were in a contracted state and she started out at 2 degrees of dorsiflexion and she couldn't get to 0 to start, then that would be 2 to 8 degrees. Okay? All right. Plantar flexion is the same, except you're going the opposite direction. Same landmarks, everything. Makes it nice, right? So now let's relax. What's normal dorsiflexion? 20 degrees, okay. And I'm going to have you point your toes as far as you can. Okay, now look, I want you guys to come here if you can't see, because this is the mistake that students often make, is they want to line it up with this. But we are looking at calcaneus movement, so you need to line it up with the base of the heel. Big difference lining it up with this or this, okay? And so she's got right there, she started at 90, okay? We can turn this around, maybe get it. She really is starting at 90. There's a 0 mark on the inside circle, so that's what I'm going to use. About to get a cramp. And she ended at 50. So I'm lining that up with a parallel line. Okay? So she goes 0 to 50. What's normal? 50. Oh my gosh, you're normal. Okay.